Hello, everybody. Welcome back to the Incubator Podcast. We are live at the CHNC Symposium in Denver, Colorado. We are joined this afternoon by two attendees, Dr. John Chuo. Is that how I'm pronouncing it correctly?
John Chuo.
John Chuo, I'm sorry.
That's all right.
And Dr. Abeer Azzuqa from Pittsburgh Children's Hospital, and John is from CHOP. Guys, welcome to the podcast.
Thank you.
Thank you.
We were talking a little bit briefly off air that you are involved with the digital health focus group of the CHNC. I feel like I'm learning about a new focus group every minute. There's always there's so many focus groups.
For sure.
Can you tell us a little bit about what is even the digital health focus group? What are your areas of focus and priorities?
Sure. Do you want me to go?
Sure.
Yeah.
You will both get the opportunity to speak as long as you want, so I would not worry too much.
Okay. So as you know, with COVID, digital health and telemedicine really took a front stage.
Yeah.
And and before that, we were trying to get people to do telemedicine, and it was like pulling teeth.
Can I ask, so what's the difference in nomenclature between telemedicine and digital health?
Sure. Digital health is more of an umbrella term.
Yeah.
And telemedicine is a specific type of digital health.
Fair enough.
Perfect. Okay.
And so what we're really interested in is to see how digital health, and when we were talking, Abeer and I, how can we use digital health to improve clinical care in the journey of a baby
Yeah.
Love that.
across the NICU? Right?
Yeah.
And so we actually in 2022 got a group of colleagues together, and we published in the seminars a series of manuscripts. Each of us kind of took an aspect of it, and we went through when we published and we talked about using telemedicine in certain parts of this journey, from the time the baby is actually from mom being pregnant to the time the baby goes home.
Yeah.
Yeah.
Well, I think a lot of people don't think about telemedicine, remote medicine in neonatology. So where are some of those uses?
You were going to add something, Abeer. Yeah.
Sure. So when we started talking about this in 2019. About since
What
we are,
great timing.
it was phenomenal timing. So we started actually exploring establishing the focus group, especially being part of CHNC, which is a unique opportunity for us to actually have this collaborative. CHNC foster all the collaboration. So we started talking about the digital health focus group, and we launched actually maybe a month or two before the pandemic hit. So it was a tsunami growth in all the activities we've done. And the big idea for us is to actually have all the collaboration that we can and all the ideas, share all what's going on amongst the CHNC sites. And this will be an opportunity not only to share practices and improve patient outcome, but also to study what we are doing within digital health.
Yeah.
John actually worked on great papers, and one of the things that he had the STEM framework. So this was one of the things that we talked about all the time, how to leverage this to what we are doing. And this will be like a really great opportunity for us to work on collaboration, multi-center QI and studies. And this is how we started back in 2020, actually, when we started our focus group.
Very interesting.
Yeah.
And so what's interesting to me is that this is really the tip of the spear when it comes to really trying to deliver the best possible care, because obviously we're talking about the CHNC, we're talking about a consortium of hospitals that have a lot of services already available. We're not talking about telemedicine in order to get expert consultation in a remote level too, even though that's a component. But you're talking about some of the babies with some of the most complex pathologies, and how do we get all these experts together so that we could have consensus approach to treatment protocols and so on for individual patients. That's quite neat.
Well, you know, what's different from us and this digital health is it's not disease specific.
Right.
So we're not talking about BPD. We're not talking about gastroschisis. So the advantage that we have is we actually can collaborate
Yeah.
With all
across the board with all
Yeah.
the groups and say, look, how can we help you deliver care in a better way.
Wow.
And telehealth is not a substitute for in-person care. The way we like to think of it, now it's about hybrid care now, right? I mean, this is healthcare, in this modern age.
Yeah.
How do we, what kind of care, what aspect of how you take care of patients is best used using digital health, and what's best used for for in-person care?
Yeah, for sure.
And we don't know. We're trying to figure this out.
Yeah.
Yeah.
I'm wondering what you think the future looks like. You're mentioning well, this is the future of healthcare, but what does that mean for your group, and what are your plans for the next steps?
So this is a great question, and actually this is something that with the future, and I think this is one of the silver lining of the pandemic. Telemedicine has been here for a while, but now how to leverage telehealth to our care. So the medicine is the same, but how we can actually use this tool, which is the way that we look at it, to improve, number one, the care, have access to the specialized neonatal care regardless where the patient is located at. So this is how we see telemedicine helping in our field, which is we are neonatal intensive care unit, and how telemedicine can help. So it can help at every single step of that journey, whether before the baby's born, after the baby's born, during resuscitation, during the stay, and beyond the stay. So I think the future for telehealth, the sky is the limit when it comes to there, and seeing how rapid all the digital tools and now even the equipment that we are using is becoming more robust. The cameras that we use to do consultation for patients who are located in other institutions, they are way better, and the technology is getting better. So I think this is going to be part of our future in neonatology, where the entire network is connected, whether it's with subspecialists, whether it's even within the same stay where we can connect with the parents. This is part of what we do, connecting with most of the parents are trying to be there all the time, but sometimes there are other things that they need to attend to, and it will be really great to have that connectivity and also connecting with patients down the road. And one of the things that the telemedicine itself, it's a great tool where I think it's going to help decreasing the length of stay with some of the remote monitoring. That a great example is babies who go home with an NG and monitoring those infants. So it's a huge, and I think this will help not only getting the baby to the environment where the baby will thrive developmentally, but also it will help with decreasing lengths of stay, also freeing up beds for other babies, and reduce healthcare costs, utilization benefits. So there are a lot of benefits.
Yeah, we both run post-discharge programs. Babies leave the hospital, and who takes care of the family? That first 2 to 4 weeks after the baby of medical complex leaves, they are at highest risk for being readmitted.
Okay.
Yeah.
Okay. So we both have had stories where we notice that the baby's not gaining weight.
Yeah.
We notice that the parents are not doing certain things. I mean, a parent going home, they've got so many things
a
lot of education.
Yeah, to readjust to normal life
and it's never normal, right?
Yeah, it's exactly right. It's exactly right.
So we've got that now. The other aspect of, you had mentioned digital health, right? That's not about the patient encounter. That we're really psyched about is how we can actually use digital health to help clinicians make decisions.
Interesting.
Okay, so we have a bunch of clinical guidelines, right? And we do a great job in each of our institutions making these guidelines. But where do we put them?
Yeah.
Well, we put them up on the web. We put them on a portal, and I have to go grab them, right? So we could potentially use digital tools to push the guidelines out.
Yeah.
So that when I'm taking care of a baby, okay, of certain characteristic, imagine a world where I can see the baby, I know the baby's QR code, I scan it, okay, and it takes and it grabs the baby's data from the EMR, and then it recognizes, oh, this baby fits this protocol, that protocol, and boom, it tells me, okay, I suggest you check a creatinine. I suggest you do this X, Y, and Z.
Yeah.
Yeah.
So clinical decision making, okay, I think we're much there now than we were a long time
Very
ago.
exciting.
I was driving home the other day from work, and I had about a 40-minute conversation with ChatGPT. I really did.
Yeah.
I asked it a few questions, and we just actually went back and forth on operational research.
Yeah, it's quite trippy to do that, and
It's
I've
trippy.
I've done it before. I've done it before.
Right?
Yeah.
Okay, it's so we who knows, right?
Yeah.
Digital.
Well,
This is very exciting
yeah.
work.
Anyway.
John Abeer, thank you so much for dropping by. This is very exciting stuff, and we'll be looking out for the product of the work that you guys are doing with the Digital Health Focus Group. Thank you for dropping by.
Thank you.
Thank you.
Take care.